Welcome to this masterclass on anthropology and nursing, a key topic in community health nursing, brought to you by ND Nursing Coaching. Let's begin with our first question. The scientific study of human beings, their origins, biological characteristics, and cultural development is known as which of the following? The correct answer is B, anthropology. Derived from Greek words meaning human and study, anthropology is the holistic study of humanity. In nursing, it helps us understand how human evolution, biology, and culture impact health behaviors and disease patterns. Question 2. Which nursing theorist developed the, quote, sunrise model and is globally recognized as the founder of transcultural nursing? The correct answer is C, Madeline Leininger. As both a nurse and a cultural anthropologist, she pioneered transcultural nursing. Her sunrise model guides nurses in comprehensive cultural assessments to ensure culturally congruent care. Question 3. The tendency to view one's own culture, lifestyle, and values as superior to all others is termed as what? The answer is B, ethnocentrism. This belief places one's own cultural group at the center of everything. In nursing, ethnocentrism creates severe barriers to communication and can lead to prejudice and poor patient outcomes. Next question. The process by which an individual or minority group completely adopts the cultural norms of a dominant culture, losing their original identity, is known as? The correct choice is A, assimilation. This involves complete absorption into the new culture, resulting in the loss of the original identity. This differs from acculturation, where elements of the original culture are retained. Question 5. Evaluating a culture by its own standards, rather than viewing it through the lens of one's own culture, is known as what? The answer is C, cultural relativism. This is the opposite of ethnocentrism. It is a critical anthropological principle for nurses to provide non-judgmental, empathetic care based on the patient's own cultural context. Question 6. A patient believes their illness was caused by the evil eye or nazar. This belief falls under which paradigm of health belief? The answer is C, magico-religious paradigm. This paradigm attributes health and illness to supernatural forces, spirits, gods, or magic. Patients may seek shamans or wear amulets for treatment. Question 7. A pregnant woman refuses to eat papaya, classifying it as a hot food that might cause a miscarriage. This represents which theory? The correct answer is B, humoral/hot-cold theory. This theory, rooted in ancient pathology, classifies items as intrinsically hot or cold, seeking to restore balance between these elements to treat illness. Question 8. The psychological disorientation and distress experienced by an individual suddenly placed in an unfamiliar culture is called what? The answer is A, culture shock. This feeling of anxiety, confusion, and isolation often affects nurses working internationally or patients immigrating to new healthcare systems. Question 9. When a nurse forces their own cultural beliefs and practices onto a patient, believing them to be the only correct way, it is termed as? The correct answer is B, cultural imposition. This intrusive practice stems from severe ethnocentrism, violates patient autonomy, and disregards the patient's existing cultural beliefs. Question 10. A nurse states, "I treat all my patients exactly the same, regardless of their culture or background." This attitude is an example of what cultural barrier? The answer is B, cultural blindness. While well-intentioned, this practice ignores cultural differences. By treating everyone the same, the nurse fails to accommodate unique cultural needs like dietary laws or modesty requirements. Question 11. In physical anthropology, specifically somatotyping, an individual with a muscular, athletic, and broad-shouldered build is classified as A? The answer is C, mesomorph. Sheldon's somatotypes classify body types as ectomorph, lean, delicate, mesomorph, muscular, athletic, or endomorph, soft, round. Question 12. The anthropological term for the strict societal rule mandating marriage only within one's own specific caste, tribe, or religious group is? The correct choice is B, endogamy, meaning marriage within one's own local group. This contrasts with exogamy, the rule requiring marriage outside one's own group to prevent genetic clustering. Question 13. A rare form of marriage where one woman is married to multiple husbands simultaneously is known as what? The answer is B, polyandry. This system involves one wife and multiple husbands, sometimes practiced in specific tribes to keep land intact. Polygyny, by contrast, involves one husband and multiple wives. Question 14. In community health nursing, we discourage consanguineous marriages because they primarily increase the risk of which medical condition? The answer is B, autosomal recessive genetic disorders. Marriage between close blood relatives increases the chance that both parents carry the same harmful recessive gene, leading to higher rates of congenital anomalies in offspring. Question 15. A family structure where the authority and decision-making power rests primarily with the eldest male member is called A. The answer is B, patriarchal family. In this structure, the male head holds authority. This impacts community health nursing, as a nurse often needs consent from the husband or father-in-law for a woman to receive medical services. Question 16. Strong social prohibitions against certain actions, such as pregnant women being forbidden to eat certain nutritious foods, are known anthropologically as. The correct answer is C, taboos. These are absolute cultural prohibitions, the breaking of which is believed to result in severe punishment. Nurses must use tact when addressing dietary taboos to prevent malnutrition. Question 17. The study of traditional medical systems, herbal remedies, and the cultural beliefs surrounding illness in indigenous populations is termed. The answer is B, ethnomedicine. This subfield of medical anthropology studies traditional practices like Ayurveda or tribal herbalism. Modern community health nursing integrates safe ethnomedical practices into holistic care. Question 18. In many indigenous and tribal societies, the traditional healer who acts as an intermediary between the human and spirit worlds to cure illness is called A. The answer is C, shaman. Shamans use rituals and spirit communication to diagnose and treat ailments. Community health nurses must collaborate with these highly trusted local leaders. Question 19. The ongoing process where a nurse continuously strives to work effectively within the cultural context of a client is known as. The correct choice is A, cultural competence. This is an active, ongoing process involving developing the necessary skills, knowledge, and attitudes to safely deliver healthcare that meets the unique needs of all patients. Question 20. The anthropological belief that non-human entities like animals, plants, and rivers possess a spiritual essence or soul is called. The answer is B, animism. This belief is foundational to many indigenous systems, viewing nature as alive with spirits. This influences environmental health practices, as certain areas may be considered sacred or untouchable. Question 21. Which of the following is considered a primary public health advantage of the traditional joint family system in India? The correct answer is C, built-in social security and care. While crowding increases communicable disease risk, the joint family's greatest asset is its social security. Members share financial burdens, offer psychological support, and provide home nursing care. Question 22. Beliefs, values, norms, and language are examples of which aspect of a society? The answer is B, non-material culture. Culture is divided into material, like tools and hospitals, and non-material, such as beliefs and traditions. These non-material elements significantly dictate health-seeking behaviors,